Good morning, ladies and gentlemen. Welcome to the Environmental Health webinar with the title of An Insight into the Role of Environmental Health Practitioners During COVID-19 Pandemic, Government and Private Sector. I am Putri Elinor Diana, a student in Bachelor of Degree, Safety and Health, and it is my pleasure to be the moderator for this session. The current pandemic has brought to attention the importance of environmental health practitioners in the field of health. Environmental health practitioners play a significant role in protecting public health and promoting a healthier environment. They often act as a frontliners in fighting against diseases such as the current COVID-19 outbreak. This webinar is an initiative from Department of Environmental Health, Faculty of Health Sciences to discuss the role and job prospect of EH practitioner, to raise issues on the difference of job tasks between environmental health officer and assistant environmental health officer, and to highlight the challenges and difficulty faced during COVID-19 cases. This live stream is brought to you by Masa University. If you are interested in our program, you may visit our website under Masa University and search for Faculty of Health Sciences. We will also be conducting an online course on managing safety and health at work starting August. Dear audience, if you have any inquiry or questions, you may leave your message in the chat box below. Without further ado, let's begin our session with a brief introduction on our guest speaker. Our first guest today is Mr. Vivek Dinesh. Mr. Vivek is currently working as an Assistant Environmental Health Officer at the Health District Office of Jempol. He graduated from Masa University with the Bachelor's Degree of Environmental Health and Safety. He also has a diploma in environmental health from College Sains Kesihatan Bersekutu, as well as a diploma in enforcement law from the Judicial and Legal Training Institute, UITM. In addition to that, Mr. Vivek has also obtained a certificate in investigation and prosecution of law from College Sains Kesihatan Bersekutu. He also received numerous number of Dean List Award and also Vice Chancellor Award while graduating from Masa University. Hi, Mr. Vivek, and thank you for joining us today.
Hi, hello everyone. Hi, Putri. So
Hi.
I'm Vivek Dinesh. I'm working as Assistant Environmental Health Officer currently at District Health Office, Jempol, Negeri Sembilan. So I'm working as Assistant Environmental Health Officer for 9 years. So currently at the Vector Control Department lah. So
Once
that's
again,
my
thank you for joining us today.
okay.
Next, our second guest is Mr. Daniel. Mr. Daniel is currently working as an environmental industrial hygiene executive at Enviro Works Sdn Bhd. A little bit on his education background. He graduated from Masa University with the bachelor's degree of environmental health and safety. Before that, he took a Canadian pre-university course at the President College as well as the Cambridge GCE levels at Sinaran Institute. In his study period with Masa University, he received the Dean List Award for 8 semesters from September 2015 to September 2019, and he then received the Vice Chancellor's Award on November 2019. Please welcome Mr. Daniel.
Good morning, Putri. Thank you so much. Good morning, everyone. As Putri said, I'm a EIH executive from EnviroWorks, Sdn Bhd. So I have 2 years experience in indoor air quality and indoor environment inspection. So it's a pleasure to be here today. Thank you so much.
Thank you, Mr. Daniel. For you guys' information, for the viewers' information, both of them are actually my direct senior, and I am very proud to have a very competent senior in the field. So they are also the alumni of Masa University. So without further ado, let us now begin with our first discussion session. So the first discussion session is the roles and job prospect as environmental health practitioners. Many of us still doesn't have a very perfect idea of what does the EHPs do. So let's first welcome Mr. Vivek to share with us on the roles and job prospect as environmental health officer in the health district office during combating COVID-19 cases. Please welcome Mr. Vivek.
Okay. So EHS, we as an environmental health practitioner, so we have a very important key role in handling the pandemic COVID-19. So we as a frontliner and also we are the prevention team. Okay, so we perform a lot of tasks. That is one of them is leading the rapid implementation of control at the border post. Of example for the traveler screening. So that is even though we are not Jampul is not involved in that, but we are at Kerala, Podixon, something else. About this time they are doing the traveler screening, and we are also perform implementation of quarantining rules. Quarantine, yeah. So once there is a positive cases, we will implement the quarantines. So minimum of 14 days. Then we are doing isolation of cases and contact tracing through their role in the port and also community health management. So as we know, there is a medication and we are the prevention team. So we are doing SEDs. Okay, that is one of the main role of environmental health practitioners. So that is from our government side. So let me hear from our Mr. Daniel.
All right. So for my role in private sector, it's more to prevention also. So we provide disinfection, of course. It's more to how we do the disinfection. We have to use a method that is correct according to KKM guidelines, of course. And we also need to test whether it works or not. So after the disinfection, we will do another test to verify whether it is efficient or not. So that is my role as a private sector. We do provide a lot of service actually, but we will talk about it later on. Let's move on to the next topic.
I see. So there are actually quite a difference between the role
Yes.
in government and also private sector, as mentioned by both of our speaker. So okay then, Mr. Daniel, was there any difference on the job task during the MCO phase, the restrictive MCO phase, and now the recovery MCO phase?
Yes, there is a different job task between these three phases. So as you all know that all these three phases have their own respective standard operation procedures, or we call it SOP. So the first phase is the where things get critical, where you have 100 to 200 cases per day. So that's the phase that we do disinfection to contain everything. So when we do disinfection, it's important to do the proper way. Again, I emphasize on the proper way to make sure that the area is properly clean. And when people come back to work after this phase, is to ensure their safety and health also. And for the recovery, the conditional MCO, it's a bit different because a lot of more and more industries are opening. So we have to expand our scope. So that's where we do indoor air quality testing, indoor environment testing, inspection to make sure that the building is function at the optimum level to prevent any contamination reoccurring again. So for the recovery stage of MCO, and again, it's a different phase, and also the scope is different. For the recovery state MCO, we will focus on verification to make sure that the building or any kind of workplace stays safe and stay safe as what they are. So that's the different job tasks that we do in private sector. Thank you.
Okay. What about you, Mr. Vivi? Was there any difference?
Okay, to me as a government sector, there is no differences between MCO phase, restrictive MCO phase, and recovery MCO phase. We still need to do the same task. That means we have to do our disinfection if there is a positive cases. We have to do the isolation. We still need to do the quarantine, and we still have to do we have to check their social distancing and everything. So even though every industries they already start to open everything and they are conducting everything, we still need to uh, implement and must follow the guide and SOP that MOH been issued from the uh, Ministry of Health. So we have, to me, the difference between MCO phase, the three phases also, we are same. There's no differences. I mean, between the private and government sector lah. So
For the MCO phase, the restrictive MCO phase, and also the recovery MCO phase, was there any difference between them? Like, okay, I understand that the duties are all the same, the responsibility and the roles of EHO was the same throughout, but was there like even a slight difference? Was it even more tighter during the MCO, or was it just still tight until now?
I think MCO phase is the best because they are following. I mean, they are following the procedure very strictly. So now with the recovery MCO phase, there is to me, my personal opinion, I see them not wearing masks and social distancing also they are not following. So I think recovery phase is to me is not effective lah.
Okay, I see. Okay, so as mentioned earlier about the difference in role where the various MCO was happening, I would also like to ask Mr. Vivek regarding the challenges and also the difficulty during COVID-19 cases. Was there any challenges and difficulty in your opinion as a government sector worker?
Yeah, of course, yes, we have challenges and difficulties. One of the difficulty and challenges is we have a shortage of the manpower. You know, EH, environmental practitioner, we have a lack of manpower. That is one thing lah. The second thing is we are playing with the law. We are implementing with the law. So we have to uh, we are doing our job. We have to according to our SOPs and the law. So everyone is seeing, everyone is wearing. So you have to do with you have to do by law lah. So you are doing the quarantines, you are giving the order to quarantine the house for 14 days, you are using your Section 15 for SCDC Act. So that one of the challenge is when you issue the order to quarantine at the house, then we will do the recheck. Means we will go to their home and we check whether they are following our instruction or not. So there's some breach of the orders also. We are taking action. Now we have to charge because breach of the Section 15 for Residency Act. So that's the challenges I face lah when I'm doing. I mean, so pandemic, controlling the pandemic lah.
Okay, you were explaining about the challenges and difficulty do while implementing the act, right? The law. So I would also want to ask, while you guys are doing contact tracing, was there any difficulty and challenges that you guys have to overcome, like the contact doesn't want to cooperate or anything?
Yeah, we have some cases, but we will contact the police lah because we will ask their help. But normally we will overcome this case. We can be able to find this case lah. So
Mhm.
if we are breach means we'll take action to the court lah. We judge them.
I see, I see. Thank you so much. So what about in the industrial sector, Mr. Daniel? What are the challenges and also the difficulties during COVID-19 cases that you guys have to go through? I mean, we all understand because in the industrial sector, you guys doesn't have to do the contact tracing or to implement the law. But I believe in the MCO phase, you guys had to work from home, right?
Yeah.
As others have to. So what are the challenges and difficulties that you guys have to go through?
All right. For private sector, as my company, we have different departments. Like for example, the disinfection department, the one who handles the decontamination, they're the essential workers.
Mhm.
For I handle the indoor air quality, which is not considered as, or maybe partially as a essential, but they do the hard work, and I clear out the reporting issues, everything. But that is not just the challenges and difficulties that I face. What I face is the workload,
Mhm.
since the first MCO phase is the critical phase. So there's a lot of disinfection areas that we have to cover. So we have to cover in a tight schedule. So it is quite a difficult thing to do during that phase. It's 2 weeks and then extended again. So it's another challenges and difficulty that we face is time restriction. For example, there's a resource restriction, for example, ATM, petrol, because we are a service provider, we are not enforcement. So
Mhm.
we need these resources in order to work. So another thing is time management again, as I emphasize we have to manage our time well to work with the schedule and around the SOP. And also we cannot go across borders of states, interstate travel, unless there's a verified documentation that is issued out by the company. For example, we have to register remiti, we have to make a police report. So these things are some things that we need to do during the NCO phase. And again, back to Putri again. Thank you so much.
So much. Thank you so much. Okay. So next for the next discussion, I am also very sure that the viewers are very curious about what are the safety and health precautions for the practitioner themselves during the COVID-19 pandemic. So we will start with Mr. Vivek because as an AEHO, as I mentioned earlier, you guys are supposed to implement and enforce the law. You guys are also the one doing the prevention, correct? And also doing the contact tracing. So what are the safety and health precaution that you guys take for yourself?
Okay, we as a frontliner, so prevention team, of course, safety and health precaution is very important to us. Yeah.
Mhm,
So, to my opinion, in my opinion, the best is you use N95 as a mask. We don't use three-ply lah. That's the best, and we have to um, still maintain the minimum of social distancing of 1 meter. Yeah? So that's the best. Even
mhm,
though we do know who is in front of us and what health status he have or she. So we have to take the precaution that maintain social distancing minimum of 1 meter. Okay. So and we cannot run out from sanitize our hand. Whether
mhm,
you are using sanitizer or um, you wash with your hand with your soap. Huh? Okay, that's the one of the safety and health precaution we need to take during we are handling with I mean outsiders lah, or with anyone else.
mhm,
And we also sometimes will bring the patient to the hospital or something like that. So we have to ensure the cycle we are using is sanitized. After everything you have to do lah, sanitize, disinfect. Once you are send into the hospital, everything. So that is the main safety and health precaution you have to take. So the three main thing you have to do: wearing mask, second social distancing, and also wash your hands or sanitize your hand.
mhm.
So that's my opinion lah.
So
That
that is for the AEHO. What about you, Mr. Daniel? You guys are not under the government, so you guys are a private sector. What do you guys do for safety and health precaution for yourself and for the other workers as well?
Okay. First, as a service provider, we need to make sure we have to confirm and verify that we are negative COVID-19. We have to
Mhm,
do the testing before we starting to work. So when we provide that information, it's a assurance for other clients to know that we are negative COVID-19. So
mhm,
at site, we will always emphasize on wearing PPE, our face mask, social distancing, because
mhm.
at site we do not know who has the contact or
True.
not. We do not know who has COVID-19 or not. We're just doing our job there. So the most important thing for us is social distancing. Uh, for contact tracing, we always, we do the scan for the MySejahtera app.
Mhm,
So that is important because we are not the building occupants. So we
mhm,
are as a customer or a client, we have to do that. And also we have to take care of our self hygiene. For example, we wash our hands for every time you touch something that is not yours. For example,
mhm,
if you take the LRT transportation, every time you go down from the LRT, you wash your hands immediately. Or if you cannot find a proper hand washing area, you can always carry a hand sanitizer with you.
mhm.
Um, that is regarding for my uh, the safety and health precautions. Thank you so much.
Okay. For Mr. Vivek, as mentioned by Mr. Daniel just now, usually before they start working, they undergo the test for COVID-19 to know whether they are negative or not. What about the workers in the government sector? Do they go through under this test as well or no?
um As my experience, for asymptomatic, we wouldn't go for any test. But there is a symptomatic means there's a SOB, the fever. That is means the sign of the COVID means we will quarantine them and we take samples for COVID test. That is we are doing. Because we also know the cost of the sample also not cheap, also
Yes,
quite expensive.
I see. All right. Thank you, Mr. David, and also Mr. Daniel, for a very interesting discussion. So I would go to the comment section now to look for the questions. So first, let's ask Mr. Vivek and also Mr. Daniel, both of you. A question from Rajan Sundra. Are employees being continually following the SOPs required? And what is done to continuously promote safe practices among them? Thank you.
Who go first? I go first. All right.
Sure.
All right. Thank you for the question, Mr. Rajan Sundra. So I think that employees should follow the SOP as required. But what is done to continuously promote safe practices among them? For example, we should have a floor warden or a safety and health committee to monitor this SOP, whether they are followed or not. So as I said, we always have a warning sign or a picture to, you know, to make sure that everyone knows what they're doing. If people don't know what they're doing, it's hard to follow the SOP. Maybe they're not aware of what it is or what to do. So that is my opinion on what to do to continuously promote safe practices. Thank you so much.
Sure.
Pass to you, Mr. Vivek.
Yes.
So this is very good question. So are the employees are being continuously following the SOP requirement? Quite okay. As we doing the enforcement, I personally saw every outlet or even though food premises or industry, they are doing health screening. So they are doing microbiota and they are also there's a book there, right? Their name, the contact number, and also they are screening their temperature. So this main then and also they have prepared hand sanitizers for the employees. Yeah? So I personally think they are doing continuous SOP to promote safe practice lah among them. That is my personal opinion. Okay.
Okay. So to both of our speakers, I would like to ask you guys, are there any system that sort of let's say as a demerit system, if the employee is not following the SOPs required and also not using their PPE, are there any demerit system that are implied in the sector you guys are working in?
Okay,
So Mr. Daniel.
it's a good point there.
Mhm.
I think it should be a very good, implement demerit system. But the thing is, we don't know who will handle this.
Mm.
That's the problem. We don't know who will handle this. So the thing is, we have to make sure that before you enter the building, you have to be scanned the temperature. You have to do according to the SOP. And we have a buddy system in my company where we have to monitor each other. We take care of each other. So if we see someone is sick, we ask them to go home. If we see someone's not wearing their mask, we ask them to wear a mask. It's like we have to take care of each other. That I think that it is important in a company where everyone is together in the same room. So that's my opinion. Thank you
Yeah,
so much.
I think it is very important for each and one of the employees have their own responsibility to take care of each others, right? So what about you, Mr. Vivek? Is there any sort of system in your sector?
Yeah, in my sector we are in the government, so in the health district department.
Mm-hmm.
So we will screen the temperature. Okay, we will screen the temperature whether the temperature is below 37.5. 37.5. So Yeah, of course our department also already prepares a hand sanitizer, and also we have my suggestion. So these three the address indicator lah to see whether we are fit in low risk or high risk. Uh, to be I mean you can work on it. Okay.
Okay. Thank you so much. So let's go to the next question by Salfarina Samad. So the question goes, should we do nationwide MCO during this time, or should we just concentrate on the red, yellow zone? Because as we all know, currently the cases are slowly increasing. So what are your thoughts on that, Mr. Vivi?
Okay, based on my opinion, okay, we have to consider economic wise and our job opportunities, everything. So we cannot just go on with the MCO like before. Okay, so my suggestion is we better we should concentrate on the red or yellow zone. So we have to do by that zone lah MCO. We cannot just go to MCO like the first phase because it will impact our economies, everything, otherwise.
Mm.
So I think my personal advice is we have to do an MCO, concentrate on the red or yellow zone is better lah.
Hmm. So you don't think that we have to do a nationwide, just focus on the red and yellow zone first. Okay,
Yeah,
so
I
that's
think we also implemented at Kuching. I think Kuching
mm,
really has a red zone. So
mm,
they already, I mean, quarantine all the stuff there. So we can do like that.
mm.
Okay.
Okay, so next question regarding also regarding on that. So based on the current by Tengku Nilam, I think Tengku Nilam, Tengku Ibrahim. So based on current situations, the number of cases is increasing. Do you think Malaysia will have the second wave of this pandemic, Mr. Vivek?
There is a chance because the local case is increasing already. Two numbers. Already yesterday also we have 10 cases for
Mm-hmm.
local cases. So I think we will have the second wave. Uh, I mean a high possibility lah. So what about you? What do you think?
What do I think? I think it's also a very high possibility to get a second wave. You can see these situations. For example, I take the LRT every day, so I can see that the LRT is jam packed with
Mm-hmm.
passengers every day during the peak hours. So it's very hard to regulate this. So if there's so you should always avoid crowded places, like for example the transportation, all these. But it's very hard to avoid all these. As you see, these are essential for people to go to work. So when you cannot avoid all these, there's a high chance that there will be a second wave of pandemic. So that is my opinion. But how do we handle from there? There must be a person to handle this. There must be a person to monitor the number of passengers, the number of building occupants or workers entering an area. Right.
We
Thank you
can
so much.
see the crowd places also they are not wearing masks and they are gathering also they
Yeah,
are not
exactly.
yeah they are not practicing the social distancing and the mask we are wearing also now fabric. A lot of them are using fabric mask. I personally think that it is not effective to mean the filter the virus from entering into your mouth or into your nose or whatever. So I think so that's why I'm telling you the second wave will anytime. It can be boom anytime and anywhere.
So
So second
it
wave
is
is possible lah to me.
mhm. So it is very important for the public to do self-regulatory on them and also to gain some knowledge on what is actually the best PPE to be used, right? Correct? So I would like to also ask, what are your family acceptance with your duty during this pandemic season? What do they think about your duty? Start with Mr. Daniel.
All right. Actually, my family are quite supportive. They think what I do is an important job to
Mm-hmm.
make sure that the country stays green. So I think when we have a supportive family to do and support what we do for the country, for for the community, everything. So it just it motivates me to do what I love. Thank you so much.
Thank you. Okay, what about you, Mr. Vivek?
Okay, I think they are proud of me because we are as a frontliner, we're doing a service to our nation. Okay, so it is our pleasure to do a service to our nation. So our family perspective, of course, they are happy, and we are doing something for someone. So I personally believe in karma. What you give, you get back. So what you do, when you're doing good for someone, you are doing a great job. Then why your family perspective surely will be positive lah towards you.
Okay, so I will also go back to the comment section. So I think there's one question from Siti Mashalida. Uh, how do you handle communication with contact or home quarantine, plus while maintaining the social distancing? Okay, I think this question is good for Mr. Vivek. So how do you do the communication with them?
Okay, that's why I was mentioning just now. You as the frontliner, you are dealing with the person mainly who have you have high suspect, they are positive. Okay, then you need to wear N95.
Mm.
So social distancing you have to maintain 1 meter. That's the minimum. Okay, you have to communicate. Okay, you have to talk. I think there is no problem because I personally have contact with positive patient. We are doing investigation, everything. So I still maintain 1 meter. We still can communicate. I think in the field I think there's no problem to communicate with the person who has a contact or home quarantine. Because still you can communicate why you are wearing a mask. But to me, logically, you can use any other media to contact, to communicate with them. Even you can WhatsApp, you can ask them the info. You can call them also. You can ask the info also. It doesn't mean you have to face to face 100%. You to get to communicate with them. Yeah. So that is my personal opinion. How about you,
Yeah.
Daniel?
Okay, but for a service provider, we don't really handle home quarantine. Um, but we do handle communication with contacts. As I said, mentioned earlier, we do not know who is with contact with anyone or anyone with COVID-19 or from overseas. But we just treat them. We just assume that everyone is has the chance to get COVID-19. So we just make sure that we wear PPE when we meet our client, when we communicate with anyone. Just make sure you wear your PPE. That is all. Thank you so much.
Okay, Mr. Daniel, on top of the question about communication with contact, right? As mentioned earlier, you guys also do services such as disinfection. So whenever you
Yes.
guys do disinfection in a client's house or office, do you guys require them to make sure that the office or room is empty, or they are also allowed to be there with you guys? So I mean, like for because you have to maintain the social distancing, right? So whenever you guys do the disinfection, do you guys require them to be not there, or is it okay for them to be there with you guys?
All right. For disinfection, it is advised that no one is allowed to be in the building until the work is finished
Mm-hmm.
because we're using a special chemical. It's like a coating system. So it's if someone is there, there's aerosols, there's mist.
Mm.
It can be a hazard to for the building occupants because they are not wearing PPE. We are wearing PPE. So when we do the fogging, we do misting, it's better that no one is in the building. And the ventilation should be on and off again to make sure that the chemical is ventilated and diluted after disinfection. I think I answered your question.
Yeah,
Yeah,
yeah.
I
Thank
perfectly
you.
agree with you, Daniel.
Yeah, thank you so much. And then, okay, so a question from Nur Faiza Abdul Razak. What is your opinion for undergoing mandatory quarantine at government gazetted facilities compare quarantine at home? Which one is better in your opinion? This is a very hot topic currently because some of the home quarantine is not following their self-regulatory. So, what is your opinion on this? Let's go with Mr. Vivek first.
Okay, yeah, this is this is a hot issue now. We got so now also they are telling the gelang the mean the bracelet is it COVID-19 bracelet. So very hard question to answer. So undergoing mandatory quarantine and the government gazetted facilities. Okay, we have pros and cons. Okay, if we want to go, I will say better we go for government gazetted facilities. But for now, if there is numbers of cases, we are going to the government gazetted facilities, so there will be a trouble there. Even though the best is we are going to the government gazetted facilities compared to the quarantine at home. So quarantine at home, and like I said before, they want quarantine at home. So we are not when we are not doing spot check anything means they won't be at home. They will go out as what they want, you go out as they like lah. So that's my experience when I come for the whole quarantine at home. So there's a pros and cons. So to me, it's better government gazetted facilities is better lah. How about you, Daniel?
Uh, I think I agree with you also. It's better to do mandatory quarantine at government gazetted facilities. One of the main reasons is because of human behavior.
Yeah,
You do not know what other people will do at home. You can give them all the PPE you want. You can give them all the facilities you have. They might not follow. So the one thing that can make sure that they follow is to put them in a gazetted facilities and you monitor from there. That is my opinion.
Yeah. Thank you so much to both of you because, in my opinion, it is also better for them to
yeah.
go
The
mandatory
purpose
quarantine.
of quarantine is to break the chain, break the
Yeah,
transmission.
Yeah. Break the
So
transmission.
yeah,
very true, very true. Because quarantine at home, of course, it is more comfortable. Yes, you are with your own in your own compound, in your own condition with your own family. It is all, of course, very much more comfortable. But it is also very hard for the ministry and also the authorities to track on your activities. So doing the mandatory quarantine at the government gazetted facilities is of so much better. So now, a question by Subra Kajang. So let's go with active case detection is vital. How is this maintained at present by EHOs in Ministry of Health? Thanks. So I think this question would go to Mr. Vivek as well regarding active case detection.
um, active case detection. Okay, ACD.
Mm-hmm.
Okay, how is this maintained at the present by EHNM? Okay, we actually, the patient with symptom is coming to the hospital. That is called the PCD, basic case detection. So once we get the notification, once we get the notification from the hospital or any health facilities, we will do the ACD. ACD means we will find who has the contact with the positive patient. Okay, so whether they are siblings, whether they are family members, their friends. So we will investigate and do the ACD. ACD means we will go to them, we will take samples from them, and we will quarantine them to 14 days because they have the contact with the positive cases. So that is ACD. So when we take samples and they are negative means okay, no problem. Then I positive means that is ACD we are doing. So we can break the chain of the break the chain of the transmission. So that what we are doing ACDs. ACD we are doing every day.
Mm-hmm.
Okay.
I see. Okay, so next question is from wait, let me see. I'll go with EJT question. So what is the management the management taken when a secondary school student tested positive when in school? So what is done? So let's go with Mr. Vivek again.
Okay, of course, if there's the positive, the secondary school students are vulnerable because they are, of course, their immune system is very still low. Okay, so if there's the positive, even though one student also, we have to, I mean, shut down the school. I mean, close the school, and we do all students must be go through the screening and have to be quarantined. That's the main management we have to do. That is logic, very simple. We have to do to break the chain of the transmission.
Mhm.
Okay. So that is my opinion, and not opinion. That's how to do lah. Then how about Daniel?
In okay, this is an interesting case about secondary school student. My company is located next to SMK Bangsa, so it's very interesting to see when anyone who enters the school, they have to be, the usual SOP. You have to scan your temperature and recorded who it is. But when a student is tested positive in school, uh, it's it's very hard to say because how did this student, get tested positive, and when did the student get tested? If the student is getting tested, shouldn't be the student get quarantined first before going to school? That is my question. So if the student is getting quarantined 14 days before going to school, one after it is he or her tested, it should be no problem for this student to go to the school. And I think there should be no cases of tested positive in school. Should be.
Yeah.
Thank you so much.
Thank you so much. So, Mr. Donald, another question from Sudra Kajang. So, indoor air quality monitoring is vital after the post MCO period. How is this ensured by the authorities? Thank you.
Okay, this is very. It all depends on awareness actually. So whether they're aware or not, indoor air quality for post MCO is important for business and their assets. For example, if you don't do IAQ monitoring, because you'll you'll find that there are some things inside the building during the MCO and after the post MCO, there are things that you cannot see. For example, you may have buildup of chemical, may have high relative humidity or temperature rise. These things will cause more contamination and bacteria buildup.
Mhm.
So it is actually vital for post MCO. But how is this ensured by the authorities? You have to have awareness actually, and the way we show that the way we give the awareness to the clients, because we are not just a service provider, we are a consultation service too. So we consult our clients to see whether they understand or not. If they don't understand what is indoor air quality and why is it vital for post MCO, we have to make sure that they understand, and we have to inform everyone, not just our client, but the building occupants as well, so that they understand why IAQ is important for post MCO. Thank you
Yes.
so much.
Thank you so much.
Okay, so I wanted to continue a bit AQ monitoring. Yeah.
Yes,
So
sure.
as I got some research. I will go through some research. They are telling that what COVID can spread to the air,
Mhm.
something like that. So by my personal opinion, it is very vital. We have to do IAQ monitoring after the post MCO because to ensure actually we have asymptomatic, asymptomatic COVID positive. So we have to do some research, and we have our MOH, Ministry of Health, need to ensure um, we have to form one team to do the IAQ monitoring. So IAQ monitoring to ensure the quality of the air is safe or is free from the COVID virus or coronavirus from transmission through towards the airborne lah.
Mhm.
So that is my opinion. So we have to create one team to do the IAQ monitoring. That's my opinion.
All right. Thank you so much. So another question from Rahayu Mokhtar. Based on your opinion, is our country ready for second wave of this pandemic? Let's go with Mr. Daniel first.
Okay. I think we are ready. We are more than ready. We already have we already experienced it once. So the second time, at least people know what to do, like wearing masks, all these, and we have restriction. If we go back to MCO phase, they already know what to do and what not to do. So I think our country is ready for a second wave of this pandemic. What do you think, Mr. Rivik?
To move on my opinion, okay. Why you need to go for a second wave? You don't need to go for a second wave. When you have one wave, the first wave, we can do the prevention. Okay, we can do
Exactly.
the prevention. We already giving you what to do. You already know what to do. Then why you don't want to do? Why you don't
Human
want to wear
behavior.
mask? Why you don't want to wear mask? Why you don't want to maintain the social distancing? Why you don't want to sanitize your hand? So to me, of course we are ready for the second wave. But why we have to go for the second wave? No need. No need. Just follow what the SOP will be given. Then we no need to go for the second wave. That's all.
Agree,
Yeah,
agree.
we agree. Because in my opinion, it is the most vital thing currently is the behavior of the public themselves.
Yeah.
So
Yes,
yeah, prevention has been done, knowledge has been given. So what important is their behavior and their self-regulatory. So I think let me search for another question. I think that will be the last question for today, or maybe the second last question. So okay, let's go with Mr. Rajan Sundra question. What do you think about self-regulation among our employees, students, and also public? Is the public aware of the actual cause and effect of their actions? Since we have news about complacent public like those taking their children to crowded places, malls, supermarkets, and many other places. This I experienced myself. I was out buying groceries on Sunday. I saw kids and also infants being brought to the supermarket. I was so worried. They weren't wearing masks. They weren't protected at all, and it's even more severe for them because of their respiratory system that are not completely formed yet, not like us adults. So what do you think about this? Let's go with Mr. Daniel first.
okay. Again, we go back to human behavior.
Mm-hmm.
So if you know the risk, why do we still bring our children and babies to the malls where these crowded places is a risk for COVID-19? So I think self-regulation is important if the person know what to do. If the person do not know what to do, for example, they're not wearing their mask and they go to the supermarket. I
Mm-hmm.
think it's good that the supermarket, if they have the resources, they may provide the mask for their own protection and also for their customer protection. I've been this situation before where I go for supermarket. I need to buy some groceries. I forgot to bring my mask, and they actually gave me a mask. So I think that's a good point there. Thank you.
Okay, Mr. Vivek, what do you think?
Um, to me, children going to the crowded places like malls, supermarket. I think the better way is to make sure the malls and supermarket don't allow lah. Don't
Yeah,
allow. Don't allow. So there's a board there. They put there. Okay, children are not allowed. Okay, if you are not wearing the mask means you are not allowed. So because I won't blame our nation. I mean our people because they are following what the government has given SOPs that given by the government. Okay, before this we cannot bring children to the crowded places to publish. Now already, if not mistaken, now there's no restriction, right? So they can bring, right? Yeah, if not mistaken lah. Okay, so they do not bring, but I see most of them wearing masks. But the problem is that they are using a mouth like fabric. That's I think the very vital lah. But my personal opinion, okay, I think the crowd. I mean, like places like mall, supermarket, and other places that include a gather, not mass gathering or something like that. Better you have one own regulations that you wouldn't allow the children or who are high risk. That's my opinion.
Okay, thank you so much for both of you. Okay, so a last question from me. As an alumni of Masa University from the Bachelor of Environmental and Health and Safety, so I would like you guys to briefly explain about the roles of an EHPs in private sector and also government sector. Because me myself as a student, I am still not clear of the roles. So I think it is better for you guys to briefly explain so that you guys can for students who are interested in joining can have a better and a clearer perspective of the role. So let's go with Mr. Daniel first. What is the roles, the overall roles in private sector?
In overall for practitioner in private sector, I think it's different from government since we're not enforcer. We are a service provider. Again, service provider. So in service provider, we also provide consultations. So we actually consult people what to do and what not to do. So I think in this part, we also do the testing. When we do the testing, we take the data, we collect all the data, we do inspection too, indoor environment inspection. We also inspect the MVAC system, the air ventilation, to check whether it's efficient or not. So when we do all this, then at the end of the day, if something is not right, we have to consult the client. We have to inform all the building occupants what is not right and what is wrong, all these things. And when we do the consultation, we actually correct their mistakes. So what we do is we do from testing, consult, and then we resolve the solution. We give them a solution. We recommend the appropriate way to fix the problem. That is the role of my part in private sector. Again, we also consult, advise. We make sure that the problem is solved before safety and health issues comes up. Right. Thank you so much.
Thank you, Mr. Daniel. What about in the government sector, Mr. Vivek?
Okay. Okay, as a EH practitioner in the government sector, you have a big, very, very big role. Okay, very, very big role. You are not only a service provider, you're not. You are also a. You have to look um, out of the box. You are implementing your service to biological wise, chemical wise, physical wise. Okay, because you are doing prevention. Okay, you are doing prevention because of EHP. The case is coming down. I would say that. Okay, we are preventing the case from spiking up. Okay, your role is very important. You are doing the ACDs. You are doing ACDs. You are the chain breaker, and you are doing the control. You are doing everything. So if you want to ask me what is the EHP role, means everything is your role. Okay, you are doing prevention. You are doing control. Disinfection is control. Okay. So we are only one thing we didn't do is that is medication. Medication we are not doctors because we cannot do a medication. So we are doing ACDs, we are doing control, we are doing prevention. So the case will come down with the hope that the case will come down. So EHP role is very important. Without EHP, I think the case won't come down. As the second digit, two digits as now lah.
Mm. Okay, thank you very much, Mr. Vivek and Mr. Daniel. So it is such a wonderful discussion with you guys, answering the questions and everything. So, ladies and gentlemen, I would also like to thank you for your participation in this webinar. I hope you enjoyed the program, and I also look forward for your participation in future seminars. I think we have another seminar coming tomorrow. Uh, Regarding biological hazard in the workplace, facing up the challenges on this website as well at 2:30 p.m. tomorrow. So again, if you are interested in our program and online course on managing safety and health at work starting August, you may visit our website under Masa University and search for Faculty of Health Sciences. Have a nice day and see you next time. Bye bye.
Bye.
Bye. Take care. Stay safe.